Hi, good morning, everyone. So my name is Julia Caldwell. I lead research and evaluation for the LA County Department of Public Health, Nutrition and Physical Activity Program, and the CalFresh Healthy Living program. So I'm going to be talking today about lessons learned with Intercept survey data collection in Los Angeles County. So to give you some background on our program, the LA County Department of Public Health partnered with 18 community-based agencies to deliver nutrition education and implement a variety of PSE strategies. Of those 18, 9 partner agencies were conducting healthy food events. So this included 1 early childhood education organization, 2 organizations with a network of food pantries. That was a food bank and a community-based organizations, right, that each have a kind of a network of food pantries. We also worked with 3 school districts and 3 healthcare systems. So each of those 9 partner agencies were then paired with a produce distribution agency to regularly distribute free, recovered, and edible produce to these sites. So the produce distribution agency would bring a truck, drop it off at these events, so that the sites can create bags or boxes that they would give to community members at these various sites. So during the events, indirect and direct nutrition education was made available. So the Healthy Food Access Survey was designed to gather information about CalFresh Healthy Living participants' eating behaviors, food security status, and CalFresh Healthy Living program participation. And we're also interested in kind of seeing the impact of these produce distributions, right? If we look at, if we're increasing access to fruits and vegetables at these community sites, what does that look like? So this presentation describes the kind of the survey field experience from an Intercept survey that we conducted across LA County over a 3-year period. And so the survey was administered at the time of the healthy food events at these various sites. So the same survey or questionnaire was conducted in spring of 2021, 22, and 23. So these are all cross-sectional estimates across 53 sites. As you can imagine, 2021, we're still in the thick of COVID-19 pandemic, so that threw some hurdles into our data collection. So I'm going to describe some of that. The survey participants included adults ages 18 years and older. You had to be an LA County resident based on your zip code, and you had to be at one of these events. We put the survey onto Qualtrics, so it could be self-administered online and in person. And you could either click on a survey link or a QR code. And if needed, paper versions were made available. We were able to partner with an evaluation subcontractor, which was able to provide an incentive to study participants, and they also brought tablets, which helped facilitate data collection. We used A-frames and flyers and word of mouth to promote the survey, and we offered the questionnaire in various languages, including English, Spanish, Chinese, Korean, and Armenian. The survey included 45 questions which assess the eating behaviors, food security status, chronic disease, participation in public nutrition assistance programs, program participation in CalFresh Healthy Living, and demographic questions. We also included a question of interest, basically, that would ask participants if they wanted to participate in a follow-up study in that year 1, 2021, which allowed us to actually track a subset of that sample over time. So we have 3 data points for a subset of the population. So I'm not going to present a lot about the results today because we've just finished this project, but I just kind of wanted to give you a sense of what this data looks like. You'll see each column here, time 1, time 2, and time 3. The sample ranged from 1,200 to 1,900 participants at each year. The sample was predominantly female, with the proportion of participants identifying as Hispanic and Latinx increasing over time to 59% in 2023. In 2023, you'll see that 95% of the sample lived in households with incomes less than or equal to 185% of the federal poverty level. However, you'll see that only a third of this sample is on SNAP, which kind of speaks to potential opportunities for building out referral networks at some of these sites. And approximately 30% of participants reported to going to these types of sites for food frequently. So the first lesson I'm going to talk here is kind of challenges related to COVID-19. I know you all probably experiences challenges in whatever aspect of CalFirst Healthy Living you were doing, but at the time this kind of threw a wrench in this study because we had planned to kind of be out in the field and do data collection, and stay-at-home orders said, oh, you can't do that. So we kind of shifted gears here, and we had to make the survey to be self-administered and accessible online or in paper and pencil format. And for us, a lot of the outreach and recruitment tasks shifted from our research team then to the on-site staff. So if any of our friend and partner agencies are here, we thank you. We're eternally grateful they helped with some of this data collection, which is a lot because they were also doing the food distributions as well. So in spring of 2022, the restrictions relaxed, which we found partially kind of influenced our study sample and kind of who was going to the site and was participating in the study. The second lesson here I wanted to talk about is related to pilot testing and kind of the importance of it. So we conducted a pilot assessment in December of 2020 at an elementary school site with 30 participants and determined whether all participants, including those in the lowest income brackets, had the necessary technology to actually access the survey electronically using a QR code. And the survey appeared to be an adequate method for reaching participants. But as we kind of rolled out data collection, we kind of realized that some of the sites, it was becoming more and more challenging. So data collection revealed the food pantry population in particular had fewer technology and reading skills and more trouble just accessing the survey. So in hindsight, we should have considered pilot testing at various different types of sites because these populations looked a little bit different. The third lesson here is related to study outreach and engagement. Before conducting data collection, we had one-on-one calls with each of the 9 project coordinators for each agency. And we developed tailored kind of recruitment strategies for those sites. You can see in the blue box here, these are kind of some of the considerations we gave that were given for in-person data collection. So this would have been in 2022 and 23, including whether the process involved a drive-through or a pickup, because that influenced kind of where we could help with data collection. But again, many participants needed support with reading and low technology literacy, and some sites, this was age related. So using an online survey was very challenging. The print was too small, so printing it out, having paper copies was really important for reaching those types of populations. And having at least 2 staff available on site helped address a lot of these needs. And the fourth lesson here is related to participation outreach. In Los Angeles County, it's estimated that 56% of residents speak languages other than English at home. You can see in the box here, this is actually the languages that the survey, we ended up administering it in. We did make it available in 5 languages, and identifying these languages was done by the agencies themselves on the ground, right? And they identified them as a priority instead of us saying, well, we think this is the, the need of the community, but asking, what are the needs of your sites? The flyers included a unique QR code and URL links by site. If anyone has collected data, this kind of a Qualtrics system seems wonderful, right? The data is already entered, but man, that first year we learned a lot about data collection. So to increase survey outreach, some sites had posted our survey flyer online to reach their target population. But this introduced some data issues with some participants completing the survey more than once, and as well as the introduction of bots into our system. So wow, what's happening? Why are there so many surveys completed? So thankfully our study team realized this pretty quickly. and this increase in, the number of completed questionnaires, and we added additional screening questions to kind of verify who was a real person. And at the end of data collection, Qualtrics kind of allows you to do certain checks, and we can kind of drop those false cases. But yeah, that was a fun learning experience there. So I'm going to just present two kind of findings related, preliminary findings on this data, just to kind of give you a sense of, I think, the ability of this data to kind of capture the impact of PSEs in nutrition education. So you'll see here on this slide that our participants are reporting high levels of satisfaction of the fruits and vegetables distributed at these events. So remember, this is a lot of recovered produce that is happening. So you can see that approximately 90% of participants said the quality and freshness of produce was good, very good, or excellent, as well as the variety. 68% are saying that they grew up eating this produce. And then that last bar shows you that about 78% said, I know how to cook or include this produce in my meals. And I actually see this as an opportunity for learning and nutrition education, right? The participants may be getting items they're not familiar with. And so, having that nutrition education really helps, I think, to complement it. And kind of this other slide speaks to kind of, the PSE and nutrition education. Our recruitment methods allowed the study to capture the integration of PSEs and nutrition education on key CalFresh Healthy Living outcomes. The chart here shows in the past 7 days, the number of days meeting fruit and vegetable consumption recommendations as specified by the DGA. The blue bars are participants who attended the healthy food event alone, while orange are those participants who attended the event and had nutrition education. So you're seeing that those who received the fruits and vegetables and were part of our education classes had higher consumption on these two indicators. I think I'm really excited to look into this data more to kind of see the impact of our programming and the power that kind of pairing these produce distributions can have with these community sites. So as kind of a summary slide here is kind of just thinking through data collection and being flexible when, kind of wrenches are thrown at you, and the kind of the roles and responsibilities are set clearly with data collection. To consider pilot testing at a variety of sites, particularly food pantries, if this is the type of project you'd like to pursue. And having at least 2 staff available on site helped address a lot of those needs. And having prior knowledge of spoken languages helped determine a lot of the on-site needs. So 3 years of data collection revealed challenges and lessons learned for Intercept survey data collection in community settings. I think some of these actually, I was thinking back of the first presentation on ability and disability and things related to that. And I never really thought of that in kind of the research world, but this project really brought that to light, I think. And, does our population even have access to technology? Are they they have comfort in navigating technology and the web? How old are they? And other kind of site level specific characteristics. And kind of this access to different languages really is important with this type of work. So to better understand the impact, I think, of our programs, evaluation studies should carefully plan and consider site level characteristics and the diversity of our population needs. So that's it for me. Thank you so much.